All right, wonderful. Welcome, everyone. Our topic today is health science non-degree programs, and the session is House of Health. So that was one of our previous coworkers that came up with the name, so I kind of just stuck with it over the time. So paying a little respect to our department as a whole. Okay. All right, perfect. My name is Samantha Bray. I'm the Director of Health Science for the Allied Health side. So I will talk about allied health as well as some of our other programs like Nurse Aid. I am on the Scott Northern Wake campus. We do offer classes throughout Wake Tech, so Perry Health Science campus, Public Safety Education campus, and we recently just moved our massage therapy program over to the Western Wake campus. So while I am physically at North, we do offer programs all throughout and online. So we'll go over some options for that. My contact information is on the screen. We can put that in the chat as well. We also have a department line, so I can put those in the chat at the end as well. That way, if I'm unavailable, one of our fantastic staff members can assist you. Anybody that you call can pretty much help you with what you need, so you don't have to speak specifically for me. We have a great team to assist with that. All right, so the medical programs that we have, this is just a screenshot of some of our classes and classes that we are in the process of adding will be added throughout. You can visit our website, cehealth.waketech.edu, and you would see this is exactly from our website. So you will see this at the top, and you can scroll down and click on the individual blocks to view a little bit more about our classes, but we'll go through each of these. So we have Central Sterile Processing Technician, and that's probably one of our most popular and seeked out classes that we offer. Clinical Research, Dental Billing and Coding, EKG, Fitness Trainer. We also have imaging, massage therapy, medical billing and coding. If you have taken classes with us before or have looked into our classes before, you may have seen it listed as healthcare billing and coding or healthcare billing coding part one, part two. So we've changed that to medical billing and medical coding to better suit the industry. Medical scribe, NC Fast caseworker, neuro, pharmacy, and phlebotomy. Phlebotomy is one of our other top sought out classes as well. Very lengthy interest list. We have one instructor that's full time and a few part time people. So we're trying to come up with some schedules to assist with that interest and meet the needs of that. And then I did mention nurse aid. They're now technically a separate department, but I do like to share their information as well. So our class formats, and this can really be related to any class that is for workforce continuing education, but the class formats are seated, all of it's completed in person. Sometimes you may see that completed through Teams, but you have an actual physical meeting time. Online, all hours will be completed via Moodle or Blackboard. We're in the process of transitioning fully to Blackboard, but the learning is at your convenience and there are no meeting times. You may just need to meet the instructor due dates. We also have hybrid and blended sessions where it's a combination of both of those methods. And then your online work would be in Blackboard. So most of our classes lead to an industry recognized credential. Some of our classes are for just training to enter a field specifically. So for NC Fast 2 income maintenance caseworker, you don't get an actual certification, but you get the tools in order to go to work for the county and human services to determine eligibility for play, programs like food stamps, Medicaid, and we'll go over a little bit about that class as well. Some of them lead directly to a credential where you would take the class. Then you would be eligible to take the certification exam. It is separate from the course. And then you would be able to have the credential that is recognized by the industry and should be able to enter the workforce. So additional information about our courses. The cost range is about $180 to $250. And we've added a few other classes that are a little less than hours. So it really could be as low as 125 or even $70. So we try to make our classes cost efficient for you. Potential additional costs are class materials. So the textbooks are an additional cost, and most of them are available through our Perry Health Science bookstore. And then also, like for nurse aid and phlebotomy, you may have to have additional things like scrubs and some other supplies needed for the course. Also, these courses can be completed between 2 to 12 months. So the 2-month range is more of our personal trainer and group trainer certifications, and up to that 12-month range is more for like our billing and coding classes because they are about 16 weeks each, and then plus medical terminology. So we do not have financial aid, which is what most people are probably used to hearing when they think of college and higher education, but we do have financial assistance that's available. So we have the Propel Initiative. This is something you may have seen on the news or heard on the radio before. So this form opens periodically. I believe our next one will open up July 1st. You can simply apply for financial assistance, and then someone in another department would contact you to determine your eligibility based off of grants that we have available. And they would be the ones to register for the class. And if it's a series of classes, you could just reach out to your education navigator to be re-registered for a class. Or if you want to take a different class that you're interested in, you have that option as well. They also help with the books, which is the big part, and that is through our bookstore as well. And then if there's any specific supplies that you need for the course, they assist with the purchase of those. And then also credentialing exams. So great initiative to apply for. All right, so where to start? If you're unsure about whether you want to enter healthcare or the medical field, we have a few things that you can either get started with or you can explore the options. So medical terminology is a great course to take if you're interested, you just want to kind of get a little bit more information. We've had people to take the class just to simply take the class so they can have some college experience with them. So this also is a prerequisite for some of our classes, and most of the time it will transfer over to our curriculum courses for curriculum credit. So that's something to talk to an advisor about if you're looking to go into one of our curriculum programs. Career exploration courses, we have career services programs that offer a variety of classes, not just for healthcare, but in general, different courses and fields. Excuse me one second. Thank you. And that is careerservices.waitech.edu. And then another course, while not offered through our department, it's offered through the EMS department, but BLS for healthcare providers, so basic life support for healthcare provider, and it needs to be through the American Heart Association for several of our programs because that's what is required by the clinical sites. We offer these classes at Wake Tech, mostly on the evenings on a Saturday. So you would take the class, they would check off your skills, you would take a short test, and then receive your CPR certification. It is good for 2 years, but the biggest thing is making sure it's the BLS for HCP. And other places do offer it, and make sure you do have the hands-on skills component. All right, so about the specific classes, we'll go into each one of these. And if you have questions, feel free to put them in the chat. I don't always see the chat, but we can answer those as they come up, or we can wait till the end. I'm happy with either option. So Central Sterile Processing Technician, we try to offer about every 2 weeks. In the upcoming year, we may try to offer starting like 3 weeks. So first week, second week, third week of each month is what I think we're going to try to move towards to help with scheduling purposes. But this is a high demanded career field with multiple employment opportunities. So you'll learn about the responsibilities of being a technician, learning the practical application of learned concepts, and then sterilization, disinfection, storage, and distribution of instruments, inventory management, quality assurance, and more. So this would prepare you to work in hospitals or sterile processing facilities. We do have people that are interested in working like in the operating room, and we do offer a surgical technician course. We're in the process of finding a new instructor, but that course currently is only available to hospital employees. But some similar concepts of making sure the instruments are sterile. You may also see this at your doctor's office. So depending on their setup, that could be an option as well. Clinical research. So a fun fact is that the Triangle area of North Carolina is the world headquarters for clinical research activities. So we have two classes that can be taken for this. So we have Healthcare Clinical Research Specialist and Monitoring Clinical Trials. The healthcare clinical research is a prerequisite for monitoring clinical trials, unless you already have experience doing clinical trials. So healthcare clinical research specialists will cover concepts as well as to structure and execute a clinical trial, how to navigate the regulatory requirements, and how to collect and analyze clinical trial data. So if you like data, numbers, this is a great field to enter. As well as for monitoring clinical trials, you're going to go a little bit more in depth for those trials, but also learning about how to do monitoring site visits, how to conduct them, and then also how to find sponsors because you need a financial backing to do your research. This does, when you take the certification exam, you have to have either 5 years of experience in the field, a degree with some experience, or a mixture of the two, or part-time work. So you have to have so many hours in the field. That does not mean you can't go ahead and enter that workforce in that industry. It just, in order to be certified, it takes a little bit longer if you're starting from the beginning. Dental billing and coding. This is one of our newer classes that we offer. One of our instructors that teaches the medical billing teaches or assists with ECU's dental school. And they found that a lot of students did not have a good foundation of billing and coding for dental. So we created a class for that with her assistance. And these can be essential for dental operations, and they're also in high demand. So this could be the person at the front desk at your dental office that you visit, or it could be a separate person that you may not see. So there is a two-part class. So even if you do have dental experience, we highly encourage the dental terminology, and it covers the dental terms. And so dental is for your teeth. And so it's how to code the procedures and services, techniques, materials, and dental diagnoses. Then dental billing and coding goes into it a little bit deeper, and you'll build on that terminology that you learn, and you'll learn about the revenue cycles, dental insurance types, verifications, breakdowns, estimates, and how to avoid errors when filing dental claims. So we'll see that a similar setup for the medical billing and coding, but specifically to dental, a little bit more to learn for that and a specific industry. EKG technician. So this is where they would apply the EKG, the leads, and see about your heartbeat, if it's irregular, where it needs to be. So must be proficient in English. Medical terminology is not a prerequisite for it, but if you don't have a medical background, it may be helpful to take along with it or before, even after. High school diploma or equivalent is required to take the certification exam. You could take the class without it, but in order to get the certification, you would need it. And then you'll learn the anatomy and physiology of the heart. You'll hear a lot of repetition with anatomy and physiology, but it is a lot of times specific to one area of the body or your system. Principles of the EKG, heart rhythms, heart blocks, bundle branches, and then most important thing is how to operate the EKG equipment. So that way you are able to properly place the leads in the appropriate spots and then learn how to read the strip. Fitness trainers. So we have two that are through the American Council of Exercise, personal trainer and group trainer. So this is an industry recognized credential as well, and integrated designing fitness programs based on clients' health, fitness level, and goals. We are working towards offering a pain-free performance specialist certification. One of the adjunct professors on the degree side wanted to offer it, so we are in the works of trying to offer that, but it focuses on dysfunction in injuries and pain, and how to help the client have performance based on their needs for what they need to work with. So healthcare billing and coding, like I said, is we've renamed that to medical billing and coding. And so when you go to our catalog, look for medical coding, medical billing, not healthcare coding or healthcare billing. You easily can just type in billing or coding. So medical terminology is a prerequisite. We've had some people that try to skip it and go ahead into the billing or coding classes and are not successful because it really builds on that terminology. So it prepares you to accurately locate documentation in the patient's record to support the coding procedures and assign the codes and diagnosis and procedures, and also how to submit medical charges to insurance companies and manage every aspect of the medical insurance claim process. So this is something I started working to looking at when I get my monthly statements from my insurance, to look, and it'll let you know if something has been coded or billed incorrectly. So I never really looked at it until starting to work with these classes. And so it's very important and important for your client that they're billed properly and that it has the proper code attached to it. Intro to Medical Sonography. I'm happy to say that we're offering a summer course as well as fall. I thought we would just continue doing fall and spring. We've offered it twice now, but with student demand, they want to take it over the summer, and the instructor is available over the summer. So I'm happy that we'll be offering an additional session in a few weeks. And this is geared towards people who want to enter the sonography program on the degree side, and you'll earn competitive points if you successfully complete the course. And then topics that are covered: applications, terminology, history, patient care, ethics, basic skills, and preliminary screening techniques. And a high school diploma or equivalency diploma is required to register for the course. And that is primarily because if you're going into or looking into the curriculum program, that's a requirement for their program. Massage therapy. This is not a class that you can just sign up for, like some of our other classes where you can just go to the catalog. If there's a register button, you can register. This one is a process where you attend an orientation, obtain some documentation. Our program director, Nancy Harrell, has been in charge of the program for a couple of years now and is the one that determines the eligibility for the programs, and also a lengthy interest list as well. So in massage therapy part 1, it covers theories of massage, Swedish seated massages, anatomy, physiology, and pathology, law, ethics, and therapeutic relationship. Then you continue to learn a little bit more types of massages and massage therapy too. But the greatest part about part 2 is there's a student clinic. And like I shared earlier, is now at the Western Wake campus. So I'm excited to go see the new setup there. We will start another class in a few weeks. It's a daytime program, more along the lines of like what you would consider a full-time program. We are looking at some part-time options. So we will look at our scheduling and staffing and see if we're able to offer a part-time. But we do recognize that it is a lot of times hard to commit to a daytime program, especially if you need to work or have an income while you're going to school. It also prepares you for the certification exam and it gives you practice and review for it. Medical scribe, medical terminology is a prerequisite. You learn how to chart physician-patient encounters during medical examinations or procedures, and assist with physicians and patients by locating needed information or completing forms. So if you're really good at looking at documents and looking for accuracy, note taking, uh, relaying data to another system, helping someone complete forms, a great entry-level position for healthcare and something that you can build skills on and also obtain other certifications to have different career paths in healthcare. This is something that I hadn't really seen before, but my dad unfortunately had to go to the hospital a few weeks ago, and there was a med scribe that came in with the doctor. So I appreciated seeing that role in action and what they do and taking notes. So definitely is a crucial role in healthcare. I mentioned NC Fast Caseworker earlier, so this is where you would learn various skills and for the role of an income maintenance worker to determine eligibility for services. So again, if you like data, gathering the data, compiling it, time management, and a lot of times, if you are great with communication, talking to people, interviewing, getting information, this is a great position to be in. It is a two-part class. The first part is offered through HRD and most likely at no cost to you. The second part, which is what we offer for income maintenance worker, is I believe it is $125. And we have a person that works with the County Human Services Department that teaches that class as well. Neuroanatomy and physiology. So this is one of our newer classes. We just offered it for the first time this February, and they should be wrapping up soon. This class, if you're interested in going into our curriculum department, this would be equivalent and would articulate over to their anatomy and physiology class. It's taught by one of their adjunct instructors. So our goal sometimes is, remember at the beginning I said not all of our classes lead to a credential, but some of these are able to help you get into programs or to get credit once you enter into those curriculum programs. So neuro is for the brain, covers anatomy and physiology of the nervous system and the diseases that affect it. Some topics included anatomy and physiology of neuron, brain, spinal cord, cranial nerves, and neurovasculature. I always mess up that last word. I think I said it correctly. But we have other classes that we offer with our with our counter partners in the curriculum department for their class. So primarily if you've already been in the industry and then you're trying to get certified, we offer a board review class as well. Nurse aid, this is another popular class, not only because it's required for a nursing program, it's also required for our radiography program and sonography. And it is really a great way to have an entry-level position. This is great whether you're 16 and a half up to wanting to start a different career after you either were looking for a career change or you've retired and you want to do something more and help people. This is a great, great course to take a lot of information. It is not an easy course. Some people think, oh, I'm going to take it. It's going to be easy. There are several skills. I believe we talked about there was 20 to 25 different skills that you learn about and have to be checked off on. There's a clinical rotation at the end. We either take the students to Wake Med or Rex. And then we also have some nursing home options as well. So you may have heard of this as a CNA, Certified Nursing Assistant, but nurse aid is the actual term, introduces you to basic nursing skills. I mentioned BLS for healthcare provider CPR early on. That is a requirement and must be through the American Heart Association. Physical and immunization records. There are some immunizations that you may need to get updated based on a time frame. They are all listed on the nurse aid syllabus. And then a big thing that we make sure people are aware of is having a social security number and the physical card, because while the class does not require it, it is required to take the written and skills exam. So without that, you would not be able to be eligible to test and get the nurse aid listing. So that might be something people have to work on to obtain. But that's a huge factor and a huge need for the credentialing part. All right, I'm going to exit out real quick. It would not let me play my video earlier, so I hope you can hear the audio on this. Jeff, please let me know if we can't hear.
I don't hear anything.
Okay, I might need to skip it. Let me see if I can change a setting real quick. Video effects setting.
People don't buy what you do, they buy what you do. We communicate from the outside in. Yes, people can understand it us, and that's a complicated information.
Okay, we can skip my video. I always take a chance sometimes on videos and audio, and sometimes it works, sometimes it doesn't. So technology is great until it doesn't work. But the testimonial is about a student that was going through nurse aid. Her goal is to be a radiography tech, so she's in the process of working through the other items on the checklist that are needed for that program. Phlebotomy is one of our other recent courses that we've offered for about a year now. We have a rather lengthy interest list that we're trying to work towards getting everybody in the class. In the fall, we will be able to offer, we're looking at 3 classes. We'll have a day class, an evening class, and a Saturday class, but the clinicals will be during the day. We just don't have clinical sites that are available in the evening or on the weekend. So I'm happy to say we've gone from 1 offering per semester to 2 and now 3 in the fall. So we are working towards meeting that demand. So it must be 18 years or older. If you are in our early college program, then that we work with them on getting placement for that. But generally 18 or older. And that's primarily because of our clinical sites. Some of them require you to be 18 to go to. Again, BLS for healthcare provider CPR through the American Heart Association. Physical and immunizations. If you look at the nurse aid syllabus, it'll be almost identical to that as well. And so the primary role that you see and know about phlebotomy is collecting blood specimens from patients for laboratory testing. But they've now been utilized a lot more than just blood draws. So they're able to conduct like COVID test, flu test, sometimes pregnancy test. So a phlebotomist is really being utilized a lot more than just simply blood draw. So those are topics that are covered in the class. And we have the certification is through NACLS. And so that requires 100 clinical hours and 100 successful sticks during clinical. So you may get a few more hours than the required, but 100 is the requirement. I think the last class we just finished during the day, the person that had the most sticks had like 390 successful sticks. And then she was upset that she had 4 unsuccessful sticks. So it's not perfect, but I think that was a great opportunity to share that she worked on the mannequin. They also work on blood draws on the students in the classroom. And then also some of the staff and faculty and other students come in to do blood draws so they can get used to different types of skins, textures, younger skin, older skin, so various type of people and people with thick veins, thin veins, all kinds of people. So they try to prepare you the best that they can before you go into the clinical setting. We do try to place close to your home if possible, but there could be some driving. We've had some that have been hired from their clinical site upon completing for that. And then we also had a wonderful review from a patient from Wake Med for one of our phlebotomy students. And she said that it was one of the best blood draws she had gotten, and she was an elderly patient. So that meant a lot to know that our training helped prepare him for that situation, and to have that positive feedback was phenomenal. Some upcoming classes that we are looking into: disability support specialist. So we have a few ideas for it in the very early planning of it, and to see what the industry needs and kind of create a curriculum based off of that. Mental health technician, we have the updated curriculum. We have an instructor. We tried to offer it in person, but found out that some of the people that were wanting to take the course were not local. So we're going to reevaluate the course offering for that and get that posted hopefully in the near future. And then our one that I'm very excited to offer is community health worker, and that will be offered in English and also English and Spanish bilingual. So I think we're going to be looking at the fall for that as we go through the process of being eligible to offer the course. So we're very excited. That will be our first bilingual course that we offer for allied health. And then we will be looking also at a Spanish nurse aid class. And so, of course, that depends on instructor availability and someone that speaks Spanish. So we see if there's a need, we try to meet it. And then, of course, we have more to come. An instructor reached out about the clinical trials, wanted to offer another course. We have a few of the hospitals that have some needs for like mobility aid, just to help people get up and be active while they're in the hospital and to walk around. So while maybe not a certification, but a need to meet to help the people that are on the patient side, and then to also assist the staff as well. Any questions? I know it's a lot of information at one time, and we are recording the sessions as well, so you will be able to watch the recording as well. And if you have any information, I will pull up the chat here. I think could it be free when we are unemployed? So that's where I would apply for Propel funding. So that initiative, I will put that in the chat for everyone. So for our programs, there's not like a fee waiver. Some of the classes offered through career services, where there's like career exploration, those are more than likely would be at no charge to you. They have a criteria that if you meet it, it would be eligible to you. Let me see if I can find the website. All right, perfect. Love the questions. Give me 1 second to find the career services for you. Perfect, got it. And really for career services, I always love to cross promote other programs. So these classes, it will really benefit you when you complete the class and you're looking to enter the workforce. And you may want someone to look at your resume to help do cover letters, mock interviews. Those are things that will definitely help you. Oh, and job opportunities, absolutely. So they use Handshake, and that will, when employers have postings, they have that on there. Another great thing to utilize is LinkedIn. Does anybody know what LinkedIn is? Any takers? If not, I'll tell you. So LinkedIn, I like to say, in the grand scheme of things, is a professional Facebook. Oh, perfect. Yes, someone in the chat. Thank you. So LinkedIn, having that LinkedIn is very important. I have connected with someone from Wake Med, and almost every day I feel like I see a job posting for central sterile processing, for surge tech, and those are just two ones that I see regularly, and they're all across the county. So the options are endless. So I would say for job placement, utilize those services provided by the Career Services Department. I even asked for some help with my cover letter to apply to graduate school. So that's what they look at cover letters and resumes day in and day out, and they know really how to enhance what you have. All right, so to the questions in the chat. Okay, how to receive the recording. Jeff, these will be uploaded to the website. Is that correct?
It's correct. It probably within the next 5 days, I would think. We'll get it to ITS and they'll upload it.
Perfect. And then depending on how you logged in, it may be saved in the chat as well. So various ways to get that information. And
Samantha,
oh yes.
I just also wanted to let everyone know that they'll be getting a link to their email once we have the recordings published and edited. So that's another avenue. So be able to receive an email and then go directly to that link for the live recording.
Wonderful. Thank you so much, Andrea. So another great thing is this, you may be getting information for yourself tonight. You may be getting information for a family member or a friend. So if you know anybody that is interested in these programs, feel free to share this information with them. So I'm going to put our department information, email and phone number in the chat as well. That way you have it, and that way if you have questions after our session, you can email or call. I say email is a little preferable. That way we can keep track of a little bit better of who we spoke with, but phone calls are perfectly fine. All right, so there's our department email. All right, we have some great questions in the chat. More information about community health workers. So what I will do, it is listed in our catalog. And that way you can go directly to it. And would you be interested in the bilingual or English version of that class? English, perfect, thank you. All right, so I'll put that in the chat as well. And this should take you directly to the part in the catalog. If it takes you directly to the catalog and not the course itself, you can type in community health and it will populate. Okay, make sure I get back to some of these questions up here. How many months does it take to be clinical research specialist? So to take the course, that one I think is about 14 or 15 weeks. But like I said, in order to get certified in that field, you have to have 5 years of full-time experience or a degree with some hours, taken a class and have hours in the field. So it's not an easy field to take the class, get certified, comparative to some of our other classes, but you can still work in that field and then become certified once you get that amount of work. That might be one thing that requires a degree or some additional classes to meet the requirement. So it's just a little bit to look into. Give me one. All right. Do we go over radiology? So we have a mammography class that is designed for people that are already certified. So this is kind of as close as we kind of get to that, to the imaging part. That might be something that we look at. Believe we're adding I think no, maybe that's respiratory. We do have with several imaging classes on our curriculum side. So that might be something to consider, but right now we do not have radiology for the non-degree side, some of these fields that you may learn about or want to enter require a degree. So that might be one thing to look at with the career services, is taking like a career test to see kind of where your interests lie and then what is required to enter that field. After the completion of the course, are any opportunities providing any job opportunities? So career services, I think I answered that one as well. I think that's the biggest thing. A lot of you are here for various reasons, but you're looking to either enter the workforce, career change. You may be finish high school or college, and sometimes I'm just looking for that next step in life. So career services definitely can help with that part. Healthcare administration. Yes, healthcare administration. So more so the medical billing and coding will be what aligns with that. We do have curriculum. There's I believe it's healthcare administration, and then also medical assisting programs. So if you search our Wake Tech website, you can look at those. So that just kind of depends on which avenue you're looking at. Both of those offer medical billing and coding. And so just kind of depends on what pathway you're looking at. Alrighty, receive the recording. Next EKG class, I just got availability from the instructor. We will have one starting mid-May, so that's a schedule I'll be working on this week. It will be offered on Saturdays. I think generally we've done 8 to 2, and then there'll be a few Saturdays we may skip. So about 40 hours will be in person. It's a 10-week course. And then the rest of the content is done online through Blackboard. So if you put your email, I'll put the link in here as well. If you put your email in the notify me box, we'll pull that list of people interested. And we do have a cap of 20 students for that class because it's one instructor, but because you pair up, you do work with other students on placement and kind of review some of that lecture that you learn on Blackboard. And these are great questions, by the way. Next, central sterile processing and dental billing and coding. So we're full for our April classes. We are in the process of adding, I believe, 2 more that will start in May. We have a software update that's coming in, so we might be able to add a few more for our summer, I say summer session, but during the summer. So probably have a few more classes in June and maybe July posted. So it just kind of depends on our software update. And then for dental billing and coding, we will have one coming up. I believe it will be May 20th. So next month. If it's not already posted, it will be posted shortly. And so if you haven't taken dental terminology, like I said, it's a prerequisite. And I believe that also will start on May 20th. I keep wanting to say April. We're currently in April. Okay, non-certificate course, yes. So these are non-degree, non-credit classes. So we have to do a certificate course to get the job. So depending on the job, they may require the certification. For sterile processing, they have certified and non-certified jobs. There are several people that work in the medical offices and have done on-the-job training for like phlebotomy or medical billing and coding. And now they're looking to get certified so that they can advance to those management positions. So some of them may not require the certification, but you can potentially get paid more with the certification because you have that skill set. And then also it's definitely helpful when it comes to advancement. So it really depends on the job. I always say, look at the job descriptions and see what that looks like for you and what you need. And that's why I say start with career services and take some of those, either the career tests, like the little assessments, or just searching on there. There's a few career links that are on there where you can search for the specific career, and it will give you kind of an outlook of that career and what you need to advance. Next phlebotomy class, we have probably over 100 people right now that are on this interest list. If you are interested, please email our department email. I put it in the chat a little bit ago, WCE Medical Certifications, and that is with an S, at waitech.edu. And we'll add the list. We're going to try somewhat of a different process in the fall to make sure we get people registered, but the fall we should be able to offer, I think we'll have about 50 or 60 openings. But to get on the interest list, just send us an email with your name and that you're interested in phlebotomy. Medical scribe job, remote or in person at the hospital. I'm not sure if they have remote positions. It may depend on how their jobs are set up. I would likely say in person, but it really could vary, and depending on what they need. And it may depend on where, how those medical records are accessed. So that would be something to look at for those job descriptions. If someone doesn't speak English very well, is it possible to take the nurse aid course? It's a lot of content. And so sometimes we see if people do not have a strong foundation of English, they may not be successful in the class. There's a lot of terminology. We do offer ESL and adult basic education classes, if that's something you may be interested in, to sharpen those English skills. I always tell people I'm a native English speaker and I'm learning English every day. So those are it's a skill that you will need to be successful in that class. So I think that kind of depends on where you're at or how comfortable you feel with speaking English. Some classes we are looking at, like I said, we're looking at offering a Spanish nurse aid class because the exam is offered in Spanish, but the skills exam is in English. So you would still have to have, good English skills to be able to take the test. All right. H-4 visa, I'm not as familiar with that, but that may be something to contact our international office for students. And then if you have an address in the United States, you can simply register online for our non-degree classes. So I would say that kind of probably depends on what you're looking at studying. If you're looking at the degree options, I would reach out to the international office and they can help guide you through that process. I have to say, these are really great questions. Sometimes we don't have a lot of people engaging with our Q&A at the end, so I do appreciate all of these questions, and I'm sure these are questions that other people may also have. If we complete the course for clinical research specialist, can we be hired? So that's going to depend again on, because that's a really specific industry. They may hire on a non-certified position, but you may have to have some additional classes to take. But this will let you kind of, if you're interested in it, it's a great class to take for information. We see a lot of people that are in the field and then are trying to become certified. So that one's a little bit harder, but that's something where, like so when I mentioned LinkedIn, go on LinkedIn, find and connect with maybe some people that are in that industry and do that research. Because especially a lot of these fields may require a higher level of education, not just a certificate or a certification. If I decide to get a degree, will this certification count? I'm thinking of medical billing and coding. That will be something I can check on. So the instructors that we have teach on the curriculum side. So that was in discussion previously, so I will revisit that to see if we can get an articulation agreement in place. An articulation agreement is a term we use that our class would transfer over to curriculum credit. So that will be something that I have to look into. Interested in EKG course? Is it enough to be hired? Yes. So they may if you take just the class, they may hire. I think they sometimes do on the job training for EKG. And then, but it's really helpful to be certified with that. And it's very important to come to the class, the meeting classes. I think 80% is the required to attend for classes because the instructor works at the hospital, and she said that someone took an online class, strictly online, which would be information, and nothing wrong with that. Majority of our classes are online, but they didn't know how to properly place the leads. So they had to go into depth for teaching them how to properly place leads and reading the strip. So that again, look at what the hospitals are requiring, and even doctors' offices use EKG machines for various reasons, but primarily to check the heart. And again, we'll have a class posted shortly for that since I just got the availability. Do you have Spanish classes for people who need help speaking Spanish, especially in the medical field? So right now we do not. We're entering into our first class, the community health worker, which will be a bilingual class. And that is something I am open to. We have a high Spanish speaking population in our area. And so it's very neat, and especially if you're bilingual and speak Spanish and English, it's very, very helpful. We did open house in person over the weekend, and we had a student that was interested in some Spanish courses, and luckily Maribel was there to assist and help translate both sides so that we can communicate. I've also brought out Google Translate and have communicated that way. So we are working on ways to help offer that. College and career readiness, I think they have a few support classes. I don't know if it's specifically Spanish. I think it kind of more covers all languages. And I'm not sure what their requirements are for that. It's IELCE, but I'll put the CCR link in the chat as well. So if English is not your first language, or you need to just sharpen those skills, College and Career Readiness is a great department. I worked with them previously and can really help sharpen those skills, vocabulary, reading comprehension, writing, a lot of those skills that you may need to enter the healthcare and medical field. We've had, I think we're going on 15 students that we've helped through their program to take our classes. So I think that would be something worth looking into if you need a little bit more help with English, or you're not as comfortable with English. And we are, like I said, we are working towards offering some bilingual classes. And also depends on instructors that are bilingual as well, or speak Spanish or other languages as well. Can we get certificate earlier if we complete online part earlier? So that is dependent on the instructor. Some instructors go ahead and open up the whole course at the beginning. Some open the course week by week. So we do know that some people need to work a little ahead. We offer classes all throughout the year. So if one ends, you should be able to roll right into the next course. Unless it's like the September timeframe, then it would be in January. Typically, I try not to cross over the winter break because it's nice to let our instructors have a short break, because they teach all throughout the year and also work full time. So that will be dependent on the instructor. All right, we have about 4 minutes left. Do we have any other questions? Oh, this is fabulous. Jeff, I do want to say this is a great crowd tonight.
Yeah, I think it's because of the presenter.
Oh, thank you. I appreciate it. English is my first language and need help with Spanish. Okay, great. Yes. So, for that, I believe, Jeff, maybe help me out on this, Mike Langer's department.
Yes. So Mike Langer can help you out. And I'll drop his email address in the chat.
Perfect. Wonderful. Thank you. So he offers a lot of foreign language classes. And also American Sign Language is one of those. And by the end of, I think it's a 3-part course, the third part of the course, you will be taking the whole class and only signing. So I think that is super exciting and interesting. But if you're looking at expanding those skills to speak another language, Mike will be able to help with that as well. And I think, like I mentioned earlier about being bilingual, that can be a crucial skill to have, because then you're able to assist people that might not know English as well or need some assistance to relay what they're trying to say. Like I said, English can be a complicated language, a native English speaker, and I'm still learning it every day. So, and some words it's harder to translate what they're trying to say from one language to another. Oh, thank you, Monica. Thank you so much. I said this is a group effort of getting this information to you because while I may not have all the answers, we have a great team here at Wake Tech that can get you the answers. Okay, as far as nurse aid course, why is having healthcare insurance a requirement? Great question. So it's not Wake Tech that is requiring that, it is our clinical sites that require it, because if you get hurt while you're there, they could be liable. So they require the students and also the instructors to have healthcare insurance to make sure to cover those aspects. They do have short-term policies, so if you do not have insurance, that's something that we can also assist with. I think the clinical coordinator for the curriculum side had a few options to look at some links for short-term policies. But it's really our clinical sites, and you may see that a lot, like with the immunizations. Our course does not require you to have those immunizations because we're on the non-degree side, but the clinical sites are requiring that. All right, so we have time for one more question if anybody has one. And again, if you have any questions, a lot of times we have these and questions arise afterwards. That is perfectly fine. Again, feel free to reach out to our department. Again, we have the allied health side and nurse aid. We are a staff of 3 right now. So if we don't get back to you immediately, please just give us some grace, and we promise we will respond to you as soon as possible. But we do work due diligent to make sure that we answer your questions. If you are interested in nurse aid, we are currently full for the summer, but we are trying to add another class. While it's our highest demanding time frame, our instructors do like to take some vacation time. So that's one thing to look at there. We will have more classes in the fall for nurse aid as well. And one thing to note, that if you are under 18 years old, you would have to register in person for classes. You cannot register online. And then in order to take the class, I believe when I looked it up, 16 years and older. All right, perfect. Thank you, Naomi. All right, so yeah, so again, we offer classes all throughout the year. If you don't see something on the website that's not offered, you can put your email in the notify me box. I mentioned our software update coming in, so it might look a little bit different when we get that put into the system, but there will still be a notify me box where you'll receive an email when a class is then available. If there's a class that you're interested in and you don't see it in the catalog, reach out. We are always interested in developing new courses. As long as there's a need in our area that needs to be met, we are happy to offer a variety of courses. So we are here to help support you, support those in the community, and our partners in the workforce. So I want to thank everyone for coming tonight. It's been a pleasure talking with all of you. And if you have any questions, feel free to reach out by email or phone. And if someone other than Samantha Bray answers the phone, they are happy to help you as well.